everyone, I'm Eve, this is Lilu. We work for Complete Care Health. Today we want to do a condition explainer video called pelvic girdle pain, which a lot of women get when they are pregnant. Lilu is our physio who's going to be explaining how to diagnose and treat, and I am here to be a model and demonstrate my pelvis. Alright Lilu, so do you want to explain to us what pelvic girdle pain is?
Sure, we're going to talk about pregnancy-related pelvic girdle pain. So basically, it is defined as pain that perceived around the structures in the pelvis and often during or after pregnancy when there's clearly no evidence of infection. It affects about 45% of all women being pregnant and roughly 25% of all women after pregnancy.
So Lilu, what causes pregnancy-related pelvic girdle pain?
Well, pregnancy-related PGP is complicated, if you allow me to put it that way. Despite the increasing number of studies on this topic, the pathological reason or causes of PGP remains unclear. However, we do believe certain things such as the baby growth, the posture changes, how we grow belly and our back sort of curve inwards more during pregnancy, as well as ligamentous laxity under the influence of pregnancy hormones definitely play a role in the development of PGP.
Okay, so what are some other factors that contribute to PGP?
It's a very good question. For pregnancy-related PGP, definitely muscle weakness, joint laxity, any existing pathology that contribute to these problems, poor motor control, when your muscles are too tight or too weak from playing too much sport or not enough at all. Some other risk factors like history of lower back pain, history of PGP, and history of pelvic trauma, for example, from a car accident or falling on your bum.
It's okay.
Yeah, it's quite unfortunate in that case. And some other factors like increased maternal age, first pregnancy, surprisingly, twin pregnancy, large baby, or even suboptimal or awkward baby position in the belly.
So there's quite a lot of factors that could
quite a few things, but do bear in mind these things, they don't cause PGP. They might increase the risk of you getting PGP, but it's never a guarantee.
Yeah, so which is why people come and see a physio to figure out how and why.
Yes. Now we're entering the discussion of how physio diagnose, assess and treat pregnancy-related PGP. So during our physio appointment or physio session, we will ask questions to help you identify the symptom generators, what are causing the pain, your functional disabilities, what is bothering you, any things that you used to be able to do easily, but now you have to struggle to do it. We also ask questions regarding any of the bladder and bowel dysfunctions and sexual activity dysfunctions. Do not hesitate to ask us those questions. We also offer appropriate treatment based on the severity and the behavior, or should I say nature, of your symptoms.
Okay, sounds good, sounds comprehensive. So Lilu, how do you treat pregnancy-related PGP?
First and foremost, safe and effective pain relief is always going to be the priority of our treatment, which can often be achieved by well-trained physiotherapists using soft tissue work, using dry needling, using education, and sometimes, in some cases, taping as well. After that, depending on the severity and depending on the behavior of the symptoms, we will decide what is needed for your pelvis. For example, if your pelvic muscles are too tight or too weak, we will use relevant exercise program or teach you relaxation techniques to either relax those tight muscles or strengthen up those weak muscles to either up-train your pelvis or down-train your pelvis. Do I make myself clear?
You do, yeah.
Thank you. Also, should bladder and bowel or sexual dysfunctions present themselves, you'll also be given relevant self-care and self-assess techniques so that you can manage your symptoms effectively at home. And if your symptoms are complicated and require next level care, we will refer you to the professionals or should I say, more expertise.
Cool. So, in your opinion, roughly how long would it take to recover from pregnancy-related PGP?
Well, good news for those people, for those women have PGP out there. Usually, majority of the symptoms will settle down within weeks after the delivery, if the delivery is non-complicated and smooth. However, we do see complicated cases where PGP might take 6 months or even 2 years to subside.
Wow.
I know, but look, that's why we need physio, so that we can establish a good understanding of the severity of the symptoms. We can decide how much input we need to put for our patient, and we can facilitate and even fasten the healing process of pregnancy-related PGP.
Great. Well, thank you so much for your time today, Lilu. I have
Thank
certainly
you.
learned a lot. If you feel like you might have PGP or you want to get a professional opinion, why don't you give us a call or book in online, come and see someone like Lilu or maybe one of our other physiotherapists, and we can go from there.
Great, thank you for your listening.